Good afternoon, and welcome to Singapore Healthcare Virtual Museum. I am genuinely thrilled to take you on this journey because, frankly, Singapore's story is one of the most remarkable in modern health policy and one of the most undertaught in our textbooks. Let us begin this presentation with a fact that still amazes me every time I cite it. Singapore spends roughly 4.9% of its GDP on healthcare, less than half of what the United States spends. Yet, it ranks number one globally, and they have a life expectancy of 83 years and infant mortality rate that's among the lowest in the world. Same outcomes, better in many cases, at half the cost. How on earth? That is the central question this exhibition answers. Over the next 8 galleries, we'll travel from a small military hospital opened in 1821 at the foot of Pearl's Hill, the oldest continuously operating hospital in Singapore, all the way to Healthier SG in 2023, a radical national pivot where the government now pays family doctor a flat annual fee to keep you well rather than to treat you sick. Along the way, we'll meet four ministers who shaped the system, confront the equity gaps that the global rankings politely ignore, examine Asia's ambitious genomic program, and yes, even stop at the Hawker's Cafe on the way out. Because in Singapore, no conversation about health ends without food. So, 8 galleries, one system, many stories. Kyle, take it away.
Thank you, Alex, for that great introduction. I'm going to be speaking about 2 centuries of Singapore healthcare. Singapore healthcare system did not evolve randomly. It was deliberately designed over time. This timeline shows a shift from the colonial hospital-based system to a modern population health model focused on sustainability and prevention. What stands out is consistency. Every reform built on the same principle, individual responsibility, supported by target government intervention. Unlike many countries, Singapore took a different path. It built a layered system with personal savings, insurance, and safety nets. As a result, healthcare spending is about 4 to 5% of gross domestic product, compared to about 17% in the United States. Wow. So, this timeline is not just history, it explains why the system performed differently today. This slide highlights the earliest formal healthcare structure, beginning with Singapore General Hospital in 1821. At that time, healthcare was hospital centered and shaped by the British colonial priorities. It mainly served the military, migrant laborers, and public order needs. On the surface, that sounds effective, but it was not designed for universal access. Preventative care was limited, so infectious disease remained common in port cities like Singapore. This is important because it shows the limitation of a heavy, hospital heavy system. It treats illness, but it does very little to prevent it. And this is exactly what Singapore later moved away from. This part of the timeline shifts towards public health and community involvement. By the early 20th century, Singapore faced serious threats from infectious disease like cholera and tuberculosis. These was driven by overcrowding, poor sanitation, and rapid urban growth. In response, public health ordinance was introduced, focusing on sanitation, quarantine, and disease control. At the same time, the Tan Tock Seng Hospital reflect the role of private philanthropy. So even early on, healthcare was not purely government run. This established a key ideal that continues today. Healthcare responsibilities is shared across government, community, and individuals. After independence, Singapore focused on public health, not hospital expansion. Investment in clean water, housing, vaccination, and maternal care led to rapid improvements. Life expectancy increased to about 65 years of age in the 1960s to over 75 years of age in the 1980s. This showed that health outcome improved largely through prevention, not just medical care. Then, in 1984, there was a major turning point. Medisave is introduced, requiring individuals to save for their own health care. This shifted the system towards self-reliance, and it changed behaviors. People became more cost-aware, and unnecessary use of services decreased. This becomes one of the defining features of Singapore's system. This phase strengthened the system by addressing its gaps. Medisave worked for routine care, but not for large medical costs. So, in 1990, MediShield was introduced to provide catastrophic coverage. Then, in 2003, the outbreak of severe acute respiratory syndrome, SARS, became a major turning point. Not unlike the SARS that occurred in 2019 globally. It exposed weaknesses in surveillance and coordination across the system. Singapore responded rapidly, developing digital systems to track disease and patient data. These systems later evolved into a national electronic health record. This created a more connected and integrated system, improving both care delivery and public health response. This final phase reflects Singapore's response to aging and chronic disease. In 2015, MediShield Life expanded coverage to all residents, including those with pre-existing condition. This improved financial protection while maintaining cost control. At the same time, chronic disease now account for most of the health burden, as Singapore population is aging rapidly, with projections showing 1 in 4 residents will be over 65 by the year 2030. In response, Healthier Singapore shifts the focus towards prevention and primary care. Instead of treating illness in hospital, the system now emphasizes long-term health management. So, the system is moving from reactive care to proactive care. And this is what defines Singapore models today: sustainability, prevention, and shared responsibility.
Welcome to Gallery 2. This gallery focuses on leaders who helped shape Singapore's health system. The main theme is balance. Singapore did not create a fully government-run healthcare system, but it also did not leave healthcare entirely to the free market. Instead, it built a hybrid model based on personal responsibility, government oversight, public subsidies, mandatory savings, insurance protection, and prevention. So for our first exhibit here, introduces Goh Chok Tong. His major mark was helping build Singapore's foundation of self-reliance through medical savings. The key policy connected to this era of MediSave, Singapore's national medical savings scheme, is MediSave requires people to set aside part of their income for future healthcare needs, including hospital care, selected outpatient services, and care in old age. The story here is that Singapore wanted people to stay prepared for healthcare costs before illness happened. It put the responsibility in their hands. And leaders worried that if care felt completely free, costs would rise and the system could become financially unsustainable, which is a symptom that we see in other markets. Goh Chok Tong's legacy is the idea that individuals should help finance their own care while the government still sets the rules, provides subsidies, or protects those who cannot afford treatment. His clear mark was the savings foundation of Singapore's healthcare. Our second exhibit features Koh Boon Hwan. His major mark was defending targeted subsidies, cost discipline, and quality control. As Minister of Health, he argued that healthcare should stay affordable, but subsidies should be focused on those who need them the most. He warned that making healthcare cheap for everyone could lower standards and hurt poorer citizens most because they have fewer alternatives, another symptom that we see in other markets. His story is about discipline. He supported better information for patients, public reporting of hospital bill sizes, processes, redesign, technology, and operational efficiency. He treated affordability not only as a funding issue, but as a governance issue too. His mark was keeping Singapore's systems affordable without removing cost discipline. Our third exhibit turns to Gan Kim Wan. His major mark was expanding Singapore's toward universal risk protection through MediShield Life. Before MediShield Life, Singapore already had MediShield Save and the earlier MediShield program. But older people, sicker people, and people with pre-existing conditions could still be financially vulnerable. MediShield Life changed that by expanding basic health insurance protection to all Singapore citizens and permanent residents, regardless of age or pre-existing conditions. The story here is about moving from individual preparation to shared protection. Gan Kim Wan did not remove personal responsibility or cost sharing, but he strengthened the idea that society should share the financial risk of serious illness. His clear mark was adding solidarity to a system built on self-reliance. Our final exhibit focuses on Ong Ye Kuen. His major mark was shifting Singapore from a mainly hospital-centered system toward prevention, primary care, and long-term health management. The key reform is Healthier SG. Under this approach, residents are encouraged to enroll with a regular family doctor, create individualized health plans, receive preventative screenings and vaccinations, and manage chronic disease earlier. The story is that Singapore faces aging and rising chronic disease. If the system waits until people are seriously ill, hospitals become crowded and costs rise. Ong Ye Kuen's reform moves care upstream by asking, how can people stay healthier before they need hospital care? We refer to this as SDOH, or social determinants of health, in the United States. His clear mark was the prevention turn in Singapore's healthcare.
Thank you, Cal. Welcome to Gallery 3, the performance dashboard. So you might wonder, does the system actually works? The numbers on the slide says yes, and remarkably so. So Singapore is ranked number 1 globally on the Legatum Prosperity Index health component. The country has spent just about 4.9% of GDP on healthcare versus the OECD average of around 10%, and it still achieves a life expectancy of 83 years. So half the spending but better outcomes. And 95% of residents are covered under the MediShield Life, and out-of-pocket cost has dropped nearly 9% points between 2017 and 2021. Therefore, there's a real win. But here's the tension worth holding. By 2030, 1 in 4 citizens will be over 65. Therefore, an aging, chronically ill population is the hardest challenge to manage cheaply, but it's coming fast. So to really understand how the system works, it helps to start with what's holding it together before we look at where it falls short. The foundation is what's known as the 3M framework, which layers 3 things. The MediSave, which is a mandatory individual savings for routine care, MediShield Life, which is universal insurance for catastrophic cost, and MediFund, which acts as a safety net for anyone who still can't afford care, even at subsidized rates. Government health spending has quadrupled over a decade, and inpatient subsidies now reached up to 80% for lower income households. And for citizens, it's a genuinely strong foundation. However, the gap becomes pretty visible when you look beyond their citizens. Singapore is a country and it's a home to roughly 1.08 million low-wage migrant workers, and that is about 30% of the entire workforce. These are the people who build the hospitals, the MRT lines, the condominiums, and yet they're entirely excluded from both MediShield Life and MediSave. They depend entirely on whatever insurance their employer chooses to provide. And in practice, only 63% of their migrant workers with chronic diseases take their medications regularly. The reasons are well documented here. It's the fear of losing their job if they take times off, language barriers, and employers who act as gatekeepers to care. So when the government announced expanded the subsidies in September 2024 for up to 1.1 million residents, and migrant workers were once again left out. So it made that structure gap very hard to ignore. Looking more closely at the Malay community, research shows that these people have carried a disproportionate health burden. Specifically, they've experienced high BMI, blood pressure, and fasting glucose compared with Chinese, alongside with a historically documented 5-year life expectancy gap. And part of the context for this is that the traditional healing practices, this includes Jampi, which is an Islamic spiritual healing, and Jamu, a form of Javanese herbal medicine, they've still remained a part of life for many older Malay residents. And these practices reflect a genuinely different understanding of what healing looks like. And while they carry a real cultural meaning, they are also associated with delays in seeking formal care, particularly for mental health. And there are places where the healthcare system has responded thoughtfully. The public hospitals have now offered Ramadan-specific diabetic protocols with adjusted insulin dosing and glucose monitoring designed for patients who are fasting. That kind of culturally informed adaptation matters. At the same time, only 22% of Malay polyclinic users hold a university degree, compared with over 40% for Chinese and Indian users. And that education gap has a direct effect on health illiteracy that doesn't disappear just because formal access is equal. In this gallery, I will introduce 5 innovations that are not just impressive individually, but are powerful because they are connected through a single system. So I'll start with the first innovation, which is the Selena Plus. This is one of the first examples of AI developed at national scale in routine care. And instead of specialists manually reviewing every retinal image, this system uses a deep learning to screen for multiple eye diseases at once, with very high sensitivity. And the key point isn't just the AI, it's that Singapore had the national screening data and infrastructure to train and deploy it across all public polyclinics. Next, we'll have the SG100K and Precise. They represent Singapore's precision medicine strategy. Globally, genomic databases are heavily biased towards the European populations. So Singapore is building one of the largest Asian genomic datasets to make diagnosis, risk prediction, and treatment for more accurate to its own population. So how do we do that? Singapore is correcting that by sequencing 100,000 genomes across the Chinese, Malays, and Indian populations. And this matters because treatments, risk predictions, and drug responses can differ significantly by ethnicity. So this is about making future medicine more accurate and more equitable for the Asian populations. And then we'll have the SIMPEX and National Electronic Health Records. This is really the backbone of everything else. The key idea is that one patient, one record, meaning any provider across the system can access the same data. And this enables continuity of care. But more importantly, it allows the AI tools, population health programs, and preventive care models like Healthier SG to actually function at scale. The Changi General Hospital robotics shows how automation is being used inside hospitals. And this is not just for surgery, but for logistics, cleaning, rehabilitation, and even patient interactions. This is critical because Singapore faces a workforce shortage, especially with an aging population. And robots here are not replacing doctors, they're reducing the low-value tasks, so clinicians can actually focus on care. And finally, we'll have the FH genetic testing. And this shows precision medicine moving into everyday's clinical practice. Patients are identified through primary care, then referred for genetic testing. And if positive, their family members are screened. This is a proactive, preventive medicine to identify risk before diseases develops. This slide shifts from innovation itself to actual impact and how these ideas actually reach people. So first, the MediShield Life. This isn't a technological innovation, but it's a system level one by making catastrophic insurance universal and mandatory. Singapore has ensured that everyone is protected from a large medical cost. This creates the financial foundation that allows the rest of the system, including new technologies, to be accessible without causing a financial hardship. Next is the Health Hub AI, which represents a shift toward patient-facing digital healthcare. Instead of AI being used only by the clinicians, this tool allows patients to check results, ask health questions, and manage their care directly in multiple languages. This multilingual design is important because it directly addresses the accessibility across Singapore's diverse population. Then there's the Project Wombatia, which is a public health innovation rather than a clinical one. By releasing mosquitoes that can't reproduce successfully, Singapore reduces a dengue transmission at the population level. This is a reminder that some of the most effective health interventions happen outside of the hospitals. Now, the two perspectives at the bottom highlights a key tension. From the government perspective, innovation, especially AI and prevention, is seen as essential to managing aging and chronic disease. The goal is long-term sustainability, to keep people healthier while controlling the cost. But from civil society, the argument is that these benefits are not evenly distributed. Migrant workers, about 1.08 million people, are still excluded from many subsidies and national programs. So even as the system becomes more advanced, a significant group remains outside of it.
This slide represents an interactive children's gallery designed by simplifying Singapore population health approach in a hands-on way. This activity is called Design Your Own Healthy City. Children use a touchscreen to build a city by choosing from 6 different elements like hospital, parks, clinic, housing, food options, and even bike lanes. As they place each element, they can see how their decisions affect key outcomes, things like life expectancy, healthcare costs, air quality, and even childhood obesity. What makes this effective is that it turns an abstract concept into something visual and interactive. For example, if a child focuses only on building hospitals, they see that health outcomes don't improve as much as expected, and costs goes up. But when they add parks, clinics, healthy food access, and safe housing, all of the health indicators improve together. So, the main lesson is that health is not created in hospitals alone. It is shaped by environment, behavior, and early intervention. In a simple way, this activity teaches what Singapore's system is built on, that prevention and environment matters just as much as medical care.
Over the past 15 years, I've been watching our system grow from the free British model into a unique saving-based mix, the first of its kind in the world. We move away from a tax fund NHS-style approach because free care often leads to overuse and weak management of long-term conditions. Today, our 3M system, MediSave, MediShelf, and MediFarm make sure there's a safety net, while every citizen keep a personal stake through mandatory saving and co-payment that help us to control the cost without lowering the quality. A clear example is our ward system. Patients who want more comfort or private, like an A-class ward, pay a higher price. This meets individuals' preference and bring in extra income that hospitals use to support basic care for others. By letting high-end service add to the public safety net, we use our resources wisely, meet a wide range of healthcare needs. Still, challenges remain. We see health gap in the sandwich class, while people who earn too much for Medifund but still struggling with out-of-pocket costs, and as immigrants. On the system side, we carried out a huge restructuring in 2017, bringing the entire public health system into 3 original clusters: Health, NHG, and NUHS. This gives us economics of scale. We can do centralized buying and building connect care pathway. At the same time, private equity firms actively merge GP clinic into large corporate network. This market shift means that we have to balance business efficiency with our core mission of public health for all. Looking ahead, Singapore face a super aging society and a shortage of healthcare workers. Our answer is the Healthier SG programming. Shift the focus of care from expensive hospital back to the community. I'm no longer just a sick treater. I'm now more like a health steward. By using our national electronic healthcare records and through a smartwatch, we can deliver preventive care across the whole population before people even fall sick. In the next 10 years, AI assist and the remote monitoring won't be fancy things for the high-end people. They will be the backbone of the system that match your health before you even step through the clinic's door. Well, next, welcome to our museum gift shop. Each item here captures a key idea behind Singapore's healthcare system. Our mandatory saving piggy bank reminds us that health starts with personal responsibility. The regional cluster puzzle shows how we save costs and improve scale by bringing the public system together into 3 clusters. For the policy fan, our political spectrum ruler placed Singapore at the 18 cm mark, a particular balance between the U.S. focus on equal access and the U.S. market approach. The 3N triple shout pins stand for the world's only mix of saving, insurance, and government assistance. And that's all items we sell in the gift shop. I hope you like the journey.
Welcome, and come on into the Singapore Hawker Classics Cafe. You're probably hungry after that long museum tour. This menu is basically Singapore on one tray. If you're here for breakfast, I start you at the morning table. The Kaya toast set is a classic Kopi Tiam breakfast. A Kopi Tiam is a traditional coffee shop. You get crisp toast with Kaya, which is a coconut egg jam usually served with butter and soft-boiled eggs. It is sweet, rich, and very Singaporean. Then there's roti prata with curry. This comes with South Indian food traditions. It's a flaky, crispy flatbread served with curry, and it's one of those dishes people eat for breakfast, lunch, supper, or honestly any time. And to drink, we have tarik. It means pulled tea. The tea is poured back and forth until it gets smooth and frothy. It's part drink and part performance. Now, if you want the heart of the Hawker Center, come over to the Hawker Signatures. Hainanese chicken rice is one of Singapore's most famous dishes. It looks simple, but the flavor's in the details. Tender poached chicken, rice cooked in chicken stock, chili, and ginger. And then we have Tatong Laksa. This is a Paranan-kan style noodle soup. A Paranan-kan refers to a culture shaped by Chinese, Malay, and regional Southeast Asian influences. The dish is coconut, curry, broth, prawns, and cockles. It is a creamy, spicy, and deeply tied to Singapore Straits Chinese heritage. For some rich and comforting, try nasi lemak. This has Malay roots. It is coconut rice with sambal, plus egg, cucumber, and ikan bilis. Ikan bilis are small dried anchovies. You get sweet, spicy, salty, and crunchy all in one plate. Satay plate is another crowd favorite. Char-grilled skewers with peanut sauce. You smell it before you see it. And if you want the big celebration dish, that's chili crab with mantou. It has sweet, spicy tomato chili, gravy, tender crab, and soft buns for dipping. It is messy in the best possible way. And please save room for the sweet finish. Chay dol is shaved with ice, with pandan jelly, coconut milk, and palm sugar. It is cool, sweet, and perfect after all that spice. So what should you order? For a first-timer, I'd say start with the Hainanese chicken rice and add kantong laksa if you want something bold. Split the satay plate and finish with chendol. This menu tells Singapore's story: Chinese, Malay, Indian, and Peranakan traditions sharing the same table. Enjoy.
Thank you, Kyle, Naomi, Lillian, and Sherry. This is the exit panel of every good museum, the final wall before you walk out into the world. So what should you carry with you? 5 things. The third way is possible. Singapore is neither British nor American free market. It's a deliberate hybrid, mandatory savings, universal insurance, and a safety net endowment, all stitched together by a strong state. The result? Top-tier outcomes. Good design pays for itself, doesn't it? The architectural decision made in 1984 when Medisave was launched made every subsequent reform cheaper. Medishield Life in 2015, Healthier SG in 2023. Get the design right early, and the compound interest does the rest. Data is the new public infrastructure. The health records are this century's equivalent of what piped water and public housing did for the last one. The gap is migrant workers. 1 million people, roughly 30% of the workforce, sit outside the universal coverage that the system loudly celebrates. They built the hospital, but they cannot enter the system at a subsidized rate. The next decade is prevention or bust. Aging and chronic disease will break any system built around acute hospital care. By 2030, 1 of 4 Singapore citizens will be over 65. Healthier SG in the country's bet family doctor-led prevention, not more hospital beds and the wins for the 2030. If they are right, the rest of the world will be studying it for the next 30 years. This is where our evidence came from. And finally, and so we close where we began, with a question rather than an answer. I want to be honest with you, because museums should be honest. No healthcare system in the world is perfect. Not Singapore, not the United Kingdom, not the Germany, Japan, Canada, or the United States. Every system makes a trade-off, and every trade-off has a cost. Singapore traded universalism of free care, but 1 million migrant workers pay the price for that trade. UK traded individual choice for solidarity, and now battles waiting list and chronic underfunding. The United States traded everything for a choice and pays roughly double per capita for worse outcomes than its peers. Each system reflects what its society chooses to value, and just as importantly, what it was willing to overlook. But here is the conviction I want to leave you with, and I'll be direct because this exhibition was built around it. Healthcare is not a luxury good. It is not a market commodity to be optimized purely for shareholder profit. It is a question of human dignity, the dignity of a migrant worker who built the very hospital he cannot afford to enter, the dignity of an elderly woman who should not have to choose between her medication and her rent, the dignity of a child whose future should not depend on the postal code, a passport, or a parent's payslip. Healthcare, and I believe, should be treated as a human right. That does not mean every country must adopt the same model. Singapore itself proves that the solidarity and personal responsibility can coexist, that financial discipline and social justice are not the enemies. But it also reminds us, by what it leaves out, that no system is ever finished. The work of expanding who counts as fully human in our health system, that the work is always ongoing. So as you leave the exhibition, and we hope you linger in the children's gallery and the cafe, carry one question with you. In the system you live under, who is celebrated and who is invisible? Because true measure of a healthcare system is not how well it serves the average citizen, but how it treats the person nobody is counting. Thank you for visiting. We welcome your questions on any galleries. The floor is yours.